We always thought healthcare system is one system, which is the hospital system, which is what we call acute care system. Healthcare system is at least 3 systems. But when we were a young population, we rely on only the acute care. And because that is enough. But actually, as we get older, we realize we need to fire up all 3 systems. And these 3 systems will address many of the issues that you mentioned. Acute care, continue to build it up. We're going to have new hospitals, new community hospitals, so on. The second important system to fire up is the population health system, which is we are doing so through Healthier SG. You asked about life cost approach during COVID-19. I'm not sure exactly life cost approach, but many of the things we did in COVID-19 taught us that it's possible to build up a very effective population health system. Because before COVID-19, many people actually don't know what vaccination is. Now people know. Before COVID-19, our GPs were just issuing MC, cough and cold, but now they are part of the public health system. When you got COVID, you go to them. And they do telemedicine. Before COVID-19, telemedicine was unthinkable. I must see the doctor, must literally see. Must be analog, cannot be digital doctor. But now telemedicine is possible, right? GPs are already now part of public health system. Don't lose that. We say continue. Government pay you a fee. It will in time be 20-30% of their revenue. And that fee is for you to deliver preventive care. If you deliver preventive care well, then the elderly, not just elderly, middle age, will be medically literate. Because you commit to seeing one doctor, you build up a long-lasting patient-doctor relationship. As you see the first doctor more, they will advise you what to watch out for, what tests to go for, and then your medical literacy goes up. So that's the second system. What is the third system? Third system is the aged care system. Aged, someone asked about retirement village. Aged care system is not retirement village, right? Once you have an idea of a nursing home, we are building nursing home like crazy, Everywhere popping up nursing home. For every 100 seniors aged 65 and above, we provide 3 nursing home beds. So what does that mean? Build nursing home in HDB estates? No, not that either. Means you continue living in your flat. But around your flat, there's medical support, there are volunteer support, there's social support. The most important, which group in our society suffers the most mental health issues? Sorry, it's not the youth. It's actually our elderly. And the moment they become isolated and lonely, that's when mental health issues set in and their health really deteriorate. As I mentioned in Parliament, the detrimental effect of loneliness is equivalent to 15 cigarettes a day. So sometimes we inadvertently over-care for our aged. Don't allow them to go out, don't allow them to cook, don't allow them to do anything in case something happened to them. So get VWOs, hire a maid, whatever, and do everything for the aged. But when you deprive them of dignity and agency, that's when their health really deteriorates. So we must start to set up communities and support systems all around our community, all around our estates. And that is the third pillar, aged care system. Now let me comment a bit about youths. Youths like to YOLO, right? Drink, binge drink, and do crazy things. It's not different when Mas was young, Indrani was young, and I was young. We are the same. Young people are just like that. So sorry to say, you are not very special from that perspective. Not very special. But what is very different for your generation, you grow up with internet. We didn't come across internet till well into our adulthood, right? Whereas you grow up with internet, and there's a reason why mental health issue is not a Singapore issue, no, it's a worldwide issue. So we are very sure it's not because of PSLE, right? Because that's unique to Singapore. If it's just Singapore having the problem, then maybe PSLE is the issue. But it happened to everyone in the world. No? All youths in the world are now having more challenge with mental health issues. So I strongly suspect it is the effect of globalization, and with that also social media, the kind of influences that is affecting the young. So when I was in MOE, one of the things that I thought should be built strongly into our curriculum from a very young age is digital literacy. Digital literacy for a young person doesn't mean from young you must learn how to do coding. It actually starts with cyber wellness, knowing how to use your device, what kind of sites, what information you take, what information you do not take, and how you make sure whatever toxic things is out there doesn't affect you. We must build up. You see, when you are in school, we send you to OBS. Before OBS must train you, prepare you like crazy, know how to put mosquito in repellent, this and that. I mean, prepare you so that you don't get harmed. But now a young kid can just go into the big jungle of internet and get really harmed. So I think we need to put that kind of preparation for all our kids. So when we talk about mental health issues, we should try not to over-medicalize it. It's the same as chronic illness and aging. The moment we define aging as more people having chronic illness and we must build more hospital to solve that problem, then you are firing only on one healthcare system. You'll never solve the problem. You must fire up the other two healthcare systems. Make all three work for you. For youth, mental health is the same, right? Don't over-medicalize it. Yes, we do need more mental health institution capacity, more psychologists, but on the other hand, we need to work on preventive care. Yeah. Preventive care, I mentioned earlier, cyber wellness. Second, learn how to sleep, learn how to eat, learn how to socialize, because these are the fundamental skills that make you resilient. To someone facing mental health issue, it's easier said than done, because they are not in the state to try to do any of this. But the recovery and the resilience to be built up has to be therapeutic in nature. Mental health issue is not like COVID. You get it overnight by exposure. No, it's accumulated over many years. And when the disease is like that, it takes many years to decumulate as well. And that has to be our longer term solution.